Good evening to all of you, and thank you for joining us on 13 Plus. I'm Mary Coleman. Let's jump into part 2 of our series following last night's. When you need surgery, an anesthesiologist typically provides the sedation and monitoring, while another provider focuses on the procedure at hand. But that's not always the case when you sit in the dentist's chair for oral surgery. National investigative reporter Joe Sturman discovered dentists are often allowed to do something most doctors don't: handle both anesthesia and surgery, a practice medical advocates say really needs to change.
A doctor wrote me a card, and on it said, "Legends never die, ninjas live forever."
Sheetal Patel is hardly an expert on martial arts, but she's a master at recognizing a ninja. For nearly 30 years, she was married to a man who was considered one.
He got his name because he could come in and do the impossible. And he was like, "That's because I'm a ninja, I'm in and out."
Dr. Henry Patel was a stealth operator in the operating room, a renowned North Carolina cardiologist with a heart of gold.
He was a super specialist in implanting pacemakers and defibrillators. And he loved his job, probably as much as he loved us.
A love of family and medicine that wouldn't last beyond 53 short years. In July 2020, with a half day available on his busy schedule, Dr. Patel booked a quick and routine dental procedure at this Wilmington practice. Records obtained by our national investigative team show oral surgeon Dr. Mark Austin sedated Patel, then began a simple dental implant with 2 assistants by his side. As Austin was wrapping up, Patel's oxygen levels and heart rate dropped.
And they're like, "Don't worry, we have a crash cart. We're working on him." And I'm like, "But what could have happened? Is he breathing? Is he breathing?"
When EMS arrived 20 minutes after the crisis began, he wasn't. Patel was in cardiac arrest with no pulse. But records showed the dentist involved had made no attempts at CPR, and the team failed to successfully carry out several other life-saving measures. Although EMTs were able to bring Dr. Patel back, he died 3 days later.
And it makes me so mad because Henry's death was preventable, absolutely preventable. Henry died because the people who were looking after him in that office were not trained. No other medical field allows this. Okay, we call it the medical model. The only people who don't follow it, and they're allowed not to follow it, are dentists.
In a hospital or surgery center, that medical model is what you're probably used to if you've been deeply sedated for something like a colonoscopy or put under general anesthesia for a hip replacement or heart surgery. One doctor or specialized nurse knocks you out and watches your vital signs while someone else performs the procedure. That way there's skilled backup if you stop breathing. But when you go to your dentist's office, state regulations nationwide often allow them to do something other medical professionals generally do not: handle both anesthesia and surgery.
Why do you think it is that dentists, we assume they can multitask and do both things at once?
I don't think anybody can sedate somebody safely and perform a procedure at the same time. You have to concentrate on what you're doing, right? I honestly don't see how you can do that and operate in the mouth and truly recognize when things have gotten out of hand.
Dr. Charles Cote, professor emeritus of anesthesia at Harvard Medical School, has spent decades looking at what happens when it does, examining cases where dental patients have died or been seriously harmed. His clinical research, starting in the 80s, helped to create critical guidelines for dental sedation and anesthesia, recommendations that he says have continued to evolve, improving patient safety when they're followed.
There's no law that says they have to follow a guideline. That's just common sense.
Common sense guidelines that Cote explains recommend a dentist doing surgery under deep sedation or general anesthesia should be accompanied by another provider with specific airway rescue training, be it another oral surgeon, an anesthesiologist, or a nurse anesthetist, with both people specially trained for emergencies.
If you're not used to dealing with those things every day, that's when things really go wrong.
But despite support from major medical organizations, the guidelines are not universally implemented in states across the U.S., although advocates say they could save lives.
And nobody should die having a dental procedure.
But deaths can and do happen in the dentist chair, with the 2015 study finding dental deaths and brain injuries linked to deep sedation and general anesthesia most likely to happen more than once a month. Our national investigative team looked more recently, spending months digging up dental anesthesia and sedation cases nationwide where patients died or were seriously hurt. Using records from the last 5 years, we uncovered at least 26 anesthesia-related deaths in 13 states.
I suspect that's the tip of the iceberg. There are many, many more that just don't get reported or somehow are slip under the rug and nothing happens.
Our national investigation uncovered how. While the majority of states have laws requiring that dentists report so-called adverse anesthesia events where patients are seriously hurt, hospitalized, or killed, our team discovered some of those state laws have loopholes that don't require reporting if someone has complications or dies days after the procedure. The number of reported cases aren't tracked or counted by many states. Dentists don't always report when required, and even when they do, it's often confidential, with most states only making cases involving anesthesia deaths or injuries public when a dentist is disciplined, with those files turning up alarming situations.
So they never stepped in, and this person dies as a result of lack of oxygen to the brain.
Failure to rescue. That's a perfect example of failure to rescue.
Our look at state records found a patient in Arizona who stopped breathing in a clinic where the oxygen system wasn't even turned on. A Kansas dentist and staff who kept pulling teeth, even when their sedated patient showed obvious signs of distress, with the dentist's wife sent to buy oxygen mid-surgery. And we found at least 14 deaths where the dentist delayed calling 911, waited or never performed CPR, failed to provide adequate or timely emergency care, or administer life-saving drugs to reverse the effects of anesthesia.
I would really love for the dental community to grab onto this as a societal issue to protect their patients and go back and look at what's happening.
Cote says an analysis of closed malpractice cases would give the dental community a more concrete sense of how often adverse anesthesia events happen, something we asked the American Association of Oral and Maxillofacial Surgeons about. They refused to answer questions about that and other topics, even after originally asking for additional time to respond. Several other major dental lobbying organizations declined or ignored interview requests. Still, Dr. Cote and other medical advocates continue lobbying for that second highly skilled provider to be part of dental surgery. Right now, we discovered that's not typical, with state laws often vague about qualifications for those who assist, saying they need only be appropriately trained, experienced in patient monitoring, or capable of reasonably handling emergencies.
You can't tell me a dental assistant knows how to do resuscitation, or knows how to pass a breathing tube, or knows how to do bag mask ventilation.
So if states are not being explicit in making sure that those additional personnel have specific qualifications, they're dropping the ball, in your opinion.
Exactly. Absolutely. See, that's the language that the dental community wants.
We were very blessed. We had a really good marriage.
People like Sheetal Patel, the ones left behind after dental surgery disaster, say things need to change.
Just imagine if they had been well trained, knew what they were doing, or even had attempted CPR on Henry, he would have lived.
The training of those involved in routine dental surgery was never something Patel thought to ask about. Now she's a human megaphone to make sure others do.
Silence won't get me anywhere.
Patel has never aspired to be a ninja. That was her husband's job. And she says being stealth doesn't serve the cause or the industry she's fighting.
I will use every penny I have to keep fighting, because no one should come back or come out of a dentist office as a widow.
Now, our team did repeatedly contact the dentist involved in Dr. Patel's death and his attorney. Neither responded with comment for this story. The dentist's license has been permanently surrendered. Hope you are having a great evening and will continue to join us weekdays at 7 o'clock right here for more stories just like this. We hope you'll also join us for 13 News Live at 10, where we will have more local news and all of your weather forecast. For now, we'll leave you with a live look outside, again, seeing that sunset out there in the distance. Have a great evening, and we'll see you soon.